What is the correct dosage for emergency seizure drugs? When someone has a seizure that lasts longer than usual or happens repeatedly without recovery, emergency seizure medications can be life-saving. These drugs are used in situations like status epilepticus, which is a seizure lasting more than 5 minutes, or when seizures happen in clusters. The goal is to stop the seizure quickly and safely. But how do you know the right dose? That depends on several factors, including the specific medication, the person's age, weight, and overall health. The most common emergency medications are benzodiazepines, which work fast to calm the brain and stop seizures. The main ones are diazepam, lorazepam, and midazolam. Each has different ways to be given and different dosing guidelines. For example, diazepam can be given as a rectal gel, intravenously, or as a nasal spray. Rectal diazepam is often used at home for children. The dose for children aged 6 months to 11 months is usually around 2.5 milligrams. For children aged 1 to 5 years, it's about 0.5 milligrams per kilogram of body weight, with a maximum dose of 20 milligrams. For older children and adults, the dose is typically 0.2 to 0.3 milligrams per kilogram intravenously, but no more than 10 milligrams in a single dose. Lorazepam is usually given through an intravenous line in a hospital setting. The typical dose is 0.1 milligrams per kilogram, with a maximum of 4 milligrams per dose. It can be given to both children and adults. Midazolam can be administered into the muscle, into the nose, or intravenously. The intranasal form is popular in community settings because it's easy to give. The usual intranasal dose is about 0.3 milligrams per kilogram, with a maximum of 10 milligrams per dose for adults. Intramuscular or intravenous doses are generally around 0.15 milligrams per kilogram, also with a maximum of 10 milligrams. It's very important to follow a healthcare provider's instructions and a personalized seizure action plan when using these medications. The plan will specify the exact dose, route, and timing based on the individual's age, weight, and medical history. Emergency medications like rectal diazepam or intranasal midazolam are often prescribed for home use if someone has a history of prolonged or cluster seizures. Always keep the medication and plan accessible and review it regularly with a healthcare professional. In hospital settings, if seizures do not stop after benzodiazepines, doctors may give additional medications like levetiracetam or lacosamide intravenously, these requiring careful monitoring by medical staff. Remember, emergency seizure drugs are not meant to replace daily anti-seizure medications. They are only used in emergencies. Always seek medical help immediately if a seizure lasts longer than 5 minutes or if multiple seizures happen without full recovery. Even if emergency medication has been given, professional medical evaluation is essential. Because each person's needs are different, it's crucial to consult a healthcare provider for personalized advice. They will help determine the safest and most effective dose for each individual and ensure the medication plan is up to date. In summary, the correct dose for emergency seizure drugs depends on the medication, the person's age and weight, and the situation. Benzodiazepines are the primary choice, with dosing tailored to the individual. Always use these medications as directed by a healthcare professional and follow a personalized seizure action plan to ensure safety and effectiveness.